Good morning, everybody. I'm Sayukta, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by a round rash on the skin that itch intensely. It may be due to the chemicals present in certain food items, allergy to certain medication, insect stings, sunlight, and sometimes the causes unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidence is higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can worsen your symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist Dr. Purva Sharda, live from Bhopal, who will educate us more about urticaria and its management. Dr. Purva Sharda is a MBBS, MD, Skin VD, consultant dermatologist and cosmetologist at Sharda Hospital, Bhopal. Dr. Purva Sharda has 4+ years of experience in the field of dermatology. Welcome, Dr. Poorva Sharda. Very good morning to you. Hope you are doing good.
Hello, very good morning to everyone, and a very good morning to you, Sayukta. Hope everyone is fine and in good health. How are you?
Yeah, hoping the same for everyone. Now, as today, Dr. Sharda, we are going to talk about urticaria, which is a skin condition. First of all, we would like to know what urticaria is.
So, if you go by definition, urticaria is nothing but an allergic response, right? It is, by definition, it is a very transient, reversible skin rash, which is characterized by exudation of fluid or plasma into your skin, right? Or if we call it in general Hindi terms, we call it dafod, we call it, but there are a lot of words in Hindi how we call it. It is nothing, it is just an allergic response which happens on the skin, and the reasons they can be numerous. It can be, as you said, it can be classified into acute and chronic. So acute is anything which is lasting for lesser than 6 weeks by the book, by the definition, and chronic is something which is lasting for more than 6 weeks.
Okay, so this is what urticaria is, and of course, we can characterize it into two categories, acute and chronic. We'll talk about it in detail later on. But right now, I would like to know what are the causes responsible for urticaria?
So I tell you what, urticaria as such, as per se, there are numerous causes, right? But the most common cause is idiopathic. That means that we don't know the cause. Like that is at least 30 to 40%, that we don't know the cause. You experience urticaria, we give you medication and it gets better, right? But other than that, infections are one of the topmost causes. Then what we have is drugs. Then we have like autoimmune causes, genetic causes, like food allergies. There are multiple causes, but the most common is still idiopathic that we don't know. Other than that, yes, food allergies, genetics, you have certain diseases, it can be infections, it can be drugs, it can be anything and everything.
Oh, so anything and everything can cause urticaria. So yeah, anything, and most of the time the reason, as Dr. have very well said, is unknown. They are not being able to trace why and what has caused urticaria. Doctor, as a layman, I would like to know, and I'm sure the viewers would also like to know, how does urticaria looks like? I mean, for example, if I say it's a rash, we normally have rash on our skin, especially during season change and for so many other reasons. Now, how would we understand that, okay, this is a normal rash and this can be urticaria? How does urticaria looks like?
So if you have a normal skin allergy, if you have a normal skin rash, you would just say, it is itching and it has become red, right? That is how generally people say, oh, you have an itch. That means your skin starts, either it's burning, either like tingling, or it starts, itching. and you have a red, like a erythema on your face, that is the redness on your face or anywhere in your body, right? But if you want to call something urticaria, that is characterized by what we call it as a triple response. That means there would be itching, then there would be wheal, and there would be flare. That means itching, then what happens, the skin becomes red, and then it flares up. I mean, it gets elevated above your skin, and it gets normal. Yeah, it's supposed to get normal within few minutes, within few hours. So that is urticaria. Like, not every rash is urticaria.
Not every rash is urticaria, and now at least we know how can we differentiate a normal rash from urticaria. You have said that a lot of reasons are there and could be there responsible for urticaria. Now, I would also like to know, doctor, how serious urticaria is. Is it a life-threatening thing, or it's just a rash with whatever symptoms you have said, and of course it can hamper the quality of life, but how serious urticaria can be?
Serious meaning, see, 99% of the patients, I would say, it is acute, right? It comes, you take medicines, even if you don't take medicines, sometimes it gets better, within minutes it gets better. People take a levocetirizine, it gets better. But 1% of the people, it is chronic. Chronic meaning it can, it can either lead to angioedema, it can lead to anaphylaxis. So that 1% of the population we need to take special care of. Like, we have to put them on medicines. Okay, what is angioedema? Angioedema, urticaria is basically just the swelling of your upper layer of your skin. That means your dermis, the upper layer of your skin. But
Right.
as you go deeper, your deeper dermis, your subcutaneous tissue, your submucosal tissue, if there is plasma in that area, it causes angioedema. And angioedema is a very, very severe disease. I mean, it can happen in your eye, it can happen in your hands and feet, it can happen even on your larynx, on your tongue. Imagine you can't breathe, you can't swallow, and might just collapse.
Oh,
And
so
that's
as yeah,
yes, and that's a medical emergency like we dermatologists have to deal with.
and that occurs only in the case of chronic urticaria.
Yes, chronic urticaria.
So the bottom line is that we should not ignore any symptoms related to urticaria. Even if it's acute, we need to go and see a dermatologist so that we can start a treatment, or at least we can get relief from
Yeah,
urticaria and stop it from being chronic, and again stop it from being so dangerous or life threatening.
exactly.
Doctor, as continuously we are talking about acute urticaria and chronic urticaria, the two bifurcations that we can do with urticaria, I would like you to throw more light on this.
So acute urticaria, as I already said you, is anything which is like lesser than 6 weeks of duration, right? I mean, a person coming to you saying that, oh, I had like wheels, what we call, wheels and hives, or baddal or dafar in Hindi. So अगर कुछ भी 6 हफ्ते से कम हो रहा है ना, तो अपन उसको बोलेंगे acute है ना. But if it is crossing that 6 week का duration, है ना, अगर आपको कोई भी चीज 6 week से ज्यादा हो रही है, चाहे वो हफ्ते में 1 बार हो रही हो, हफ्ते में 2 बार हो रही हो, हफ्ते में 3 बार हो रही हो, if it's crossing that 6 weeks वाला duration, then it is chronic. Then it needs to be analyzed. Then there has to be, it's like certain tests that needs to be done. We need to find out what is the etiology, and then we need to treat it. So anything, it is just like a 6 week duration, acute and chronic.
Right. And with chronic hives or urticaria, can it go away completely, permanently? Is it curable 100%?
Yes, if we find out the cause, why not? It is
Okay.
curable. Yes, we just need to find out the cause.
Okay. And the treatment duration, can it go, longer, it take longer to treat urticaria, chronic urticaria?
That is something like nobody, I think, can answer. Like, how long will it take? It might take like days, it might take weeks, months, years. I can't say that. But yes, it is treatable. That's all I can say.
Okay.
For some people, for everyone, it's different. Like, even a basic levocetirizine, it works, very slowly in some people, and it works wonders in others. So, it's very tough to say how your body will respond.
Right. We all are different, we all as individual are different. And of course, our causes, etc., behind those skin conditions or urticaria will differ, of course. So the treatment, etc., will depend on that. especially on the diagnosis of the cause. Doctor, one more thing. By whatever you have said so far, I can make out that the condition of a patient who's suffering from urticaria is very distressing, discomfort, frustrating, irritating, because he's completely, continuously itching, right? Then it definitely may cause a lot of stress to that person who's suffering from urticaria. My question is, can stress aggravate the urticaria or whatever condition he or she is currently?
See, there's a thing in dermatology which we learned is, and it's very true also, there's this something called neurocutaneous response, right? Whatever is happening on your brain, whatever happening up here mentally, it gets reflected. It gets reflected everywhere, every part of your body, and specifically the skin, right? So if you're stressed out, if anything, you're mentally, if you're going through something, if you're mentally stressed out or any other mental condition, yes, it will show on your skin. And it will obviously, if the free radicals are increasing in your body, right, they will reflect on your skin somehow or the other. It may appear as an allergy, it may appear as like an infection, like your immunity gets decreased, so you might even have infections, like multiple things might happen. And yeah, obviously urticaria might present as as a stress factor. Yeah, definitely.
Okay. Many people, patients complain that, during night their urticaria get worse. What's the reason behind that?
See, there are, again, I'll tell you two reasons, right? First of all, there is something called as, we all have steroids in our blood, like the basic, like the catecholamines in our blood. So they peak when they peak during the morning hours and they get down during the evening hours, right? So
Mhm.
like the general peak is during the morning hours. That would, I would say, like 4 o'clock to like maybe 10 o'clock. So if the steroids are increasing in our body during that period of time, everything will be fine, like steroids act as like an anti-inflammatory, anti-allergic. So if the steroids are increasing during that time, yeah, they will suppress your urticaria, but there's a slope and everything gets decreased during evening time. So yeah, if your steroids are decreasing during that time, yeah, urticaria will flare up during evening. So most of my patients come during evening. They tell me, you know, शाम को ज़्यादा हो रहा है या रात में ज़्यादा हो रहा है, but they get better during the morning hours. And also one more thing that, yeah, blood supply to your organs, specifically your skin, gets increased during the evening time. So if it's getting increased during the evening time, then more allergens to your skin and more response of your body. So yeah, two things: steroids, like that is your catecholamines, and increased blood supply to your skin. So both of them, they cause a flare up of urticaria or any skin condition, for example.
And does urticaria makes a person tired, fatigued?
Obviously, anything that's giving you stress, you would be tired, you would be fatigued. Anything which is making you feel uncomfortable, there's a fatigue, you know,
Yeah,
anything
we can
which is,
imagine a person
yes,
who's continuously itching, a person who's not been able to sleep because during night, for whatever reason, his
whatever you do.
urticaria is getting worse. Of course, he'll be tired and fatigued.
Imagine, I mean, like you have to attend a meeting and you're stressed up and you're just thinking about that flare up of urticaria during that meeting or anything for that example, any life
Mhm.
event or, any basic thing. It's very distressing to any individual. So it obviously causes a severe impact on your quality of life, your quality of sleep. Yeah.
Of course, yeah. Doctor, initially we also spoke about allergies and specifically food allergy. Now, talking about food allergy, we normally know that people, are allergic to either cashews, nuts, or they are allergic to seafood many a times, or towards eggs or cheese, etc. Brinjal. There are so many things that people are normally allergic to. Now, with urticaria, is there any dietary precaution or do's or don'ts for the patients of urticaria?
Dietary precautions in case of urticaria, right? So if you have an increased IgE level in your blood, that might be due to anything. So during that time, like whatever you eat, it might be even like, as you said, Pringles, or even it might be rice, anything and everything, it might cause a flare up of urticaria. So once you're down with that acute stage of yours, yeah, I would tell you like things you should avoid is something peanuts, then
Mhm.
seafood, then sometimes milk products also cause urticaria. Um, this is what I've seen mostly in my practice. And some people also complain, khattai khane se, like, imli ki chutney and all of these. Yeah, urticaria. And yeah, and even if you go out in the, if like city like Delhi or like where there's dust, yeah,
Right.
mostly these things, yeah.
Yeah, allergies are so common, with food, with any foreign element, with weather change, etc. And if they may trigger or cause urticaria, then of course we need to be very careful about them. Doctor, again, one thing is that normally people know, what they are allergic of, so they can avoid those things.
Yes,
But for
yes.
people who are having it for the first time, they don't know what has triggered this allergy. I mean, maybe in the last 24 hours or 12 hours, they have consumed something which may have triggered, urticaria in them. What would you suggest to those?
So see, the best thing is if it's an acute flare, right? It's just one time you would always remember, yeah, I ate that one new thing in my diet and that caused me urticaria, right? You would always
Mhm.
remember. But if it's happening again and again, right, then what you can do is you can like, like something called food diary or like a food page or something. You can always maintain, stick it on your fridge, stick it on your office, like, wherever you have time,
Okay.
and just think about it. What I ate in the last 12 hours or 24 hours, and just write it down, pen it
Mhm.
down. And then, once you come to the doctor, you can bring it like, over like last 15 days, this all caused me a flare of urticaria. So, things get easier. Like you wouldn't remember what you ate like, 2 days ago. But like if you jot it down somewhere, you can bring it to your doctor and, like we can tell you like, things that might cause urticaria. So it's always better, like, if you jot it down.
Yes, so
Maintain a
maintaining
food
a
diary.
diary, or not if a diary, then at least on stick on papers, you can
Yes.
write them, in like last 24 or 15 hours, I have consumed this, and this may have triggered urticaria. So
Yes.
maintaining a, urticaria diary or whatever, jotting it down is important, and it may actually help you with your treatment. I'll pick few of the questions that our viewers are pouring in. Prince Sharma is asking about the treatment of cold urticaria.
So cold urticaria, so anything if exposed to cold, it gives you urticaria. Yeah, like why don't you try hot compresses first thing?
Mhm.
You avoid all that cold triggers. Second of all, always like with a basic levocetirizine, you can start. If you feel like, you're exposed to cold, if you're going out on the mountains or something, like be warm. Like you don't have to expose yourself on the cold, and just be a little cautious. You can carry heating bags with you. Like, you can be a little cautious about that. You can like immerse your hand in hot, not extremely hot water because you won't feel anything, but like, lukewarm water, you can immerse your hands, you can immerse your feet. And,
Mhm.
if you have experienced that, you can always be cautious about it.
Exactly. The most important thing is to know the cause. If you know the cause, if your doctor knows the cause, then at least you can be more careful about it. Shruti Nigam is asking, I'm suffering from chronic urticaria and taking treatment of it for last 8 months, but never seen any improvement. Please tell me, is there any treatment of this disease?
See, I can't comment to this. First of all, who are you taking this treatment with? If you are visiting a qualified dermatologist, like at 8 months, I think the doctor should tell you like this is causing you urticaria, or you can go for like hormonal profiles and autoimmune profiles, and look for a basic thing like if you have a fungal infection or maybe it's your diet. So you need to consult your doctor properly, and that doctor will tell you what is causing it. If not, you go for a few tests,
Mhm.
and yeah, and you might even change your, like, I'm not sure what you're taking, but like you need to like maybe change your prescription.
Exactly. So we have Shalini Baghel asking, if I need medicine, in case I need medicine, what are the possible side effects?
In case you need medicine for what, like it's
A
a
very
very vague question.
hypothetical,
Yes, it's
condition. Yeah.
I can't comment on that, but you're talking about levocetirizine. As per se, I will tell you sedation, but I can't like tell you about every medicine. But if you're not going to a doctor, and if you're just going over the counter in any medical store, if you're asking for basic drug or levocetirizine, yeah, I'll tell you sedation, but I can't comment on every drug.
Even with anti-allergens, sedation may happen to one person and may not happen to one person. So it actually depends, but it's always better, Shalini, that you go and consult your doctor before going for any medication. It's important, and doctor will probably tell you the side effects, or in case you have any difficulty, you can again consult with your doctor. Sonia Ayer is asking, what is the best treatment of resistant chronic urticaria? Antihistamines also she is mentioning. Before you answer Sonia's question, doctor, I would like to ask you, what are the treatment options available for urticaria?
See, treatment options, first of all, is you remove that trigger factor. I'll tell you what, that's the best thing that works. But yeah, we're living in India, we're living in a tropical country. So there's so much dust, there is sweat all the time. So you can't remove these things, right? But levocetirizine works the best. In my practice, the cheapest and the most effective drug, you take it for continuously 3 months. It suppresses your IgE levels and it is the best. But in case if you want to like move ahead and if it's not working, then there are a lot of drugs like cyclosporin, methotrexate. You can even ask your doctor to try like a trial of autologous serum, like the ALS injections. And if you can afford like a higher drug, then there's omalizumab. And there's a very new drug coming in the market by Novartis, leglizumab. I was on the clinical trial with them. And so I'm looking forward to that drug. Like, in my clinical trial, I gave it to a lot of patients and I think they're fine till now. So maybe you wait for that drug when it's in the market, it might give you good results.
Right. Now we have, Vijeta Modi. She is asking, is urticaria, can it be genetic? And you also said that one of the causes, genetic,
Yes.
Right.
See, if your parents have it, like if they have, like, there's something called IgE, like the eosinophils. Normally you have it like 1 to 6. That's the very normal level in your blood. But, genetically, sometimes people do have an increased IgE level. So if your parents have it, you have it, right? So yeah, it might like, there is a possibility that if your parents are suffering from urticaria, you might even suffer from urticaria. It is
Okay.
genetic, I mean, yeah.
Okay. Now, doctor, I would like to ask, what happens, especially with skin allergies? People have this notion in their mind that I'll also get this from him or her. So, with urticaria, what the truth is it contagious?
No, it's not a virus. It's not COVID. It's not contagious. I mean, it's in your blood. Like your blood can't travel, and it's something which has to do with your IgE levels. It's not at all contagious. I mean, you don't need to worry about it. I mean, it's not going to spread like that. Please don't worry about it.
Yes, so I think we would like to, aware our viewers again about it. So, see, urticaria is not contagious. किसी और को अगर है तो उससे आपको नहीं होगा, तो डरने की जरूरत नहीं है. और जिसे भी है, जिसे भी ये symptoms है, प्लीज उन्हें डॉक्टर के पास लेकर जाइए ताकि उन्हें इसका सही ट्रीटमेंट पता चल सके, आराम मिल सके. We have Sahil Khan with us asking. मैम, बारिश के मौसम में बहुत जल्दी बॉडी में रिएक्शन हो जाते हैं, तो महीनों तक रहते हैं, इसका क्या सोल्यूशन है?
See, you're talking something about fungal infections. It's not urticaria. तो बारिश के मौसम में अगर कुछ हो रहा है, तो पहली बात तो it is sweat, which is not evaporating for your body. मतलब शरीर पे sweat, like आप कुछ भी sweat out करते हो. गर्मी में तो क्या होता है, वो चला जाता है अपने आप से, environment में उड़ जाता है. But बारिश के टाइम पे because इतना नहीं होता है, तो वो आपकी बॉडी पे चिपक जाता है, राइट? तो आप नहाइए दिन में 2 बार 3 बार जितना पॉसिबल है. बारिश के महीने में ज्यादा मॉइस्ट कपड़े मत पहनिए, है ना? कोशिश करें कि आप आयरन कर लें अपने कपड़ों को, स्पेसिफिकली योर इनरवेयर्स, एंड उसके बाद पहनिए. तो जो फंगल इन्फेक्शंस हैं, दिस इज नॉट अर्टिकेरिया, राइट? तो इट विल हेल्प यू आउट, मतलब it will get better. And you visit a dermatologist, that is what I'll tell you, because you're talking about something which is very vague. Barish mein all the skin infections, they increase. You need to find out
go and consult a dermatologist. Shilpi Yadav is asking, does heat, cold, they trigger your hives?
Yes, they do. Like there's something called pressure urticaria. So if you're wearing very tight garments, it might trigger. If you're going out in the sun, something called cholinergic urticaria. If you go out in the sun, so like it happens on your face or any exposed areas of your body. Then, as somebody already asked me about cold urticarias, so yeah, there are inducible urticarias. They only happen when you are exposed to either heat, cold, but your body determines it.
Right. I would also like to ask you, doctor, especially last 2.5 years में during the COVID era, कई लोग आए जिन्होंने कहा कि कोविड की वजह से उन्हें चेहरे पे या बॉडी में हाइव्स हुए हैं, या हाइव्स हुए हैं और उसके बाद उन्हें कोविड डिटेक्ट हुआ है, वो पॉजिटिव हुए हैं. तो इन बातों में कितनी सच्चाई है? क्या कोविड की वजह से भी अर्टिकेरिया हुआ है?
See, I told you the etiology. I mean, I initially in the start of our talk, we talked about viruses, bacteria, fungus.
Mhm.
They are a very important cause of urticaria, right? So COVID is a virus after all, right? Like there are hundreds of viruses. COVID is also a virus, so it might even cause urticaria. Matlab, it might cause an allergic reaction where there is just redness on your face, there is just itching, but yes, it might even cause urticaria. I have even seen cases of urticarial vasculitis with COVID. I've seen a lot of things with COVID. So urticaria is one of it. Urticarial vasculitis is another thing, and the spectrum goes on and on. Yeah, I mean, answering your question, yes, COVID is a virus again. It might cause urticaria.
And that won't be too serious. I mean, it will fade
No, no.
away.
Yes,
Mhm.
yes, yes. So the virus goes, urticaria goes.
Okay. Now, doctor, another thing is what we generally do whenever we see any kind of skin reaction, be it urticaria or anything else, we try to get immediate relief from it, because itching is actually very irritating. So we would like to do some home remedy. Many people apply aloe vera gel over it. Many people directly apply the aloe vera from the aloe vera plant, which normally people are having these days at their place. Now, how safe those home remedies are they good or are they bad in a way because they'll actually worsen the condition?
See, again, I'll tell you, these are very vague questions. I mean, if something is working for you, it might not work for someone else, right?
Mhm.
If like aloe vera is soothing after all, so if you have like a heat urticaria and if you apply aloe vera, yeah, why not? It will help you, but it might not help, somebody else. If you're
Right.
using calamine lotion, if you're using that kapoor, that camphor, so it depends. Like it might work for you, it might not work for someone else. But if something is repeatedly happening to you, I would suggest you go consult your dermatologist. I mean,
Mhm.
even Ayurvedic things, I will not deny it, but they do have like a soothing property. They do have like they do help you out. Like, they do help out diseases. So yeah, if you're using some home remedies, it might be honey, it might be anything. If it's working for you, well, good enough. But it might not, like, I can't state the fact that, if honey or aloe vera or calamine lotion is the treatment line. If it's working for you, well and good, but like it might not for others.
And as you have already said in the beginning that anything and everything can cause you urticaria.
Yes,
हो सकता है
yes.
हनी से मुझे रिलीफ मिल रहा हो, लेकिन कोई और है जिसको हनी से ही एलर्जी हो और हनी ही उसको ट्रिगर कर रहा हो, तो ये भी पॉसिबिलिटी है। इसीलिए हम बार बार कह रहे हैं कि डॉक्टर के पास जाना, डॉक्टर को दिखाना जरूरी है। डॉक्टर, कई बार ये होता है कि जो आपने कहा कि व्हाट माइट वर्क फॉर मी may not work for the other person with the same conditions because the cause may be different, etc. Now the thing is, मेरे किसी फ्रेंड को यही प्रॉब्लम हुई, उसने जो दवाई ली उसको आराम मिला, मुझे पता चला मुझे भी ये सिम्टम्स दिखे, तो मैं डॉक्टर के पास जाने की बजाय मैं उसका प्रिस्क्रिप्शन फॉलो करना मुझे आसान लगेगा। ये नॉर्मली हम लोग करते हैं। या फिर एक और चीज होती है, हम केमिस्ट के पास जाते हैं, केमिस्ट से ही सजेशन ले लेते हैं, ओवर द काउंटर मेडिसिन बाय कर लेते हैं, उसका इस्तेमाल करना शुरू कर देते हैं। हाउ सेफ इज दैट? और अगेन, can it worsen my condition?
See, chemist is going to give you a levocetirizine, है ना? He will not tell you कि इसको इतने time लेना है, इसको इतने time लेना है. He will not tell you how to tighter the dose, how to increase the dose, when to decrease the dose. Like he is not going to tell you this. This only a doctor is going to tell you. So like अब वो 400 रुपए, 200 रुपए, I don't know जो भी डॉक्टर की फीस है, वो बचाने के चक्कर में आप अपने शरीर पे एक्सपेरिमेंट मत करो. I will just tell you this. Like we have studied, I have spent my 11 years of my life reading about medicine, so I think I'm like at a better place to give you advice. Acute urticaria hai, if you're experiencing hives, aapne ek aad baar levocetirizine le liya, it worked for you, good enough, है ना? But if it's happening to you again and again, बार बार हो रही है, बार बार दिक्कत हो रही है, खुद ही आप दवाई ले रहे हो, खुद ही एक्सपेरिमेंट कर रहे हो, होम्योपैथिक ले रहे हो, आयुर्वेदिक ले रहे हो, यार लाइक एक डॉक्टर पकड़ लो जिसको आप ट्रस्ट करते हो एंड जस्ट फॉलो दैट पर्सन. डोंट गो इस बार इस डॉक्टर के पास चले गए, इधर से आराम नहीं मिला, नहीं, ऐसा नहीं होता. यू फाइंड अ डॉक्टर हु इज वेल ट्रेन्ड, क्वालिफाइड, एंड यू गो, मतलब यू ट्रस्ट दैट डॉक्टर कि हाँ ये जो बोल रहा है, आई फॉलो दिस. क्योंकि मुझे नहीं पता व्हाट अदर डॉक्टर इज गिविंग यू. आई माइट हैव टू स्टार्ट you all over again. So it depends. And as a self experiment, तो I don't think you should ever do. एक आध बार लीवोसिट्राजिन ले लिया, I understand that कि हाँ चलो ठीक है, डॉक्टर के पास जाने का टाइम नहीं मिला, but if it's happening to you again and again, I would suggest कि go see someone.
I can completely understand your point, and there is it's not worth taking risk, क्योंकि ultimately हम अपनी ही condition, अपनी ही health के साथ खिलवाड़ कर रहे हैं, और अगर हमारी condition worse होती है, जैसा कि डॉक्टर ने पहले भी बताया, हो सकता है initially आपको acute urticaria है, आप डॉक्टर के पास एक बार गए, एक बार मेडिसिन लिया, आपका प्रॉब्लम ठीक हो गया, लेकिन अगर आपने ऐसा नहीं किया तो चांसेस हैं कि आपका urticaria बार बार वापस आता रहेगा, वो chronic बन जाएगा, और फिर हो सकता है वो कभी बहुत एक लाइफ थ्रेटनिंग या बहुत ही बुरे स्टेज पे भी पहुंच जाए। तो वहां तक हमें अपनी प्रॉब्लम को लेकर ही क्यों जाना है, क्यों ना पहले ही डॉक्टर से मिलकर उसका सोल्यूशन हो पहले। एक और चीज डॉक्टर मैं जानना चाहूंगी, अगेन इट हैपेंड मेनी अ टाइम्स, लाइक फॉर एग्जांपल आई हैव chronic urticaria, I'll come to you, you'll diagnose the thing, then you'll send the treatment for me, prescribe me a few medicines, etc. Now I've started taking those medicines, and after say 1 or 1.5 months, I'm feeling all right. I'll stop using the medicines without even asking you. Then again, maybe after 15-20 days, I'll again have the symptoms. I'll again, take out the prescription, the old prescription, and again I'll follow the prescription without talking to you or consulting to the doctor. And this will keep on going. ये बहुत आम है हमारे सोसाइटी में। इस केस में आप क्या सजेशन करेंगे?
See, I'll tell you कि prescription जो डॉक्टर लिखता है वो 15 days या एक महीने से ज्यादा लास्ट ही नहीं करता है ना? There's something called steroids which we give in cases of an acute urticaria. आप इतने itching में हो, levocetirizine might not help. We might write you steroids for that. And you don't know, मतलब steroids, they are very harmful to your body. Until unless prescribed by a doctor, please don't take it, है ना? And we know what we are doing. Like, let us do what we know best. Doctor bano mat bane ki koshish karo. That is what I'll tell you. So if a doctor has given you a course for like 3 months straight up, take it. 1.5 महीने में शायद वो चीज नहीं आ पाएगी आप जो आप चाह रहे हो, जो आप रिजल्ट चाह रहे हो. See, again, 15 दिन में again you will again start itching, again you'll start having hives, again we want to suppress your immune system, we want to suppress that IgE levels. That is the reason we told you कि इतने महीने चलेगा ये course, या 4 महीने चलेगा, 5 महीने चलेगा, because we know it best. We have seen so many patients. Yeah, blindly I will tell you कि don't try experiments specifically on your body. Levocetirizine I understand, but don't, if a doctor has written you steroids or anything else, like any immunomodulator, I will tell you, please don't.
Right. So again, the same thing, don't experiment with your health. Please go and consult a doctor before it's too late or before your condition worsens. So it's always, always, always advisable to go to your doctor. डॉक्टर आपने बताया कि कई बार एलर्जीज होती है जिसकी वजह से अर्टिकेरिया ट्रिगर होता है, दूसरी वजह होती है, तो ऐसे में जब एक पेशेंट डॉक्टर के पास जाते हैं तो क्या उन्हें कौन कौन से लैब टेस्ट करने को कहा जाता है? आजकल एलर्जी टेस्ट भी बहुत कॉमन हो गया है, people at least are aware about it. How good or credible are those allergy tests?
First of all, अच्छा, आप कोई डॉक्टर आया मेरे पास with acute urticaria, right? I'll ask you in a basic history, कोई बीमारी तो नहीं है, कोई viral infection तो नहीं है ना? अगर person is telling me cough cold हुआ था, urticaria हो गया, why would I go for a test? Tell me this thing, है ना? Why would I want you to spend money? If you're coming to me कि हाँ घर में सफाई हो रही है, dust ज़्यादा है, urticaria, I'll write you something, I'll send you back because I know what is the cause, right? But why would I suggest, like allergy tests are not like एक तो cheap. They are expensive, like at least 5K, and they might even go to 30K in metro cities. So why do you want to spend so much money? And specifically when you're in that acute stage of your disease, when anything and everything, like, basic dust, even anda, anything which you're eating regularly might even produce a response. So I don't recommend allergy test as per se, because there are certain things like you can't avoid dust in India. Like you can't just move to temperate countries. You can't do that. So a doctor is the best judge कि कब test कराना है, कब नहीं कराना है. But the one test I would recommend is like a IgE level. I'll get your CBC done, I'll get your IgE level done, your ESR done, and your CRP levels. If I feel that, you're not responding to my medicines, or if it's happening again and again. But if I feel that I know the cause already, I'll ask you if you've eaten something. But if I know the cause, then yeah, definitely not. But these are the basic tests I would recommend anyone who
Right.
comes to me.
ओके कई बार ये भी होता है कि खुद से इसलिए भी टेस्ट या एलर्जीज टेस्ट स्पेशली नहीं कराने चाहिए क्योंकि इतनी सारी चीजों से एलर्जिक आप निकल जाते हो. मान लीजिए आपके टेस्ट में आया कि देयर आर 30 फूड आइटम्स यू आर एलर्जिक टू. यू कांट अवॉइड और omit those 30 items from your plate. It's not it's not feasible, it's not possible practically. So it's always good to trust your doctor. They know what's best for you, even when we talk about lab test. We have Sonu Yadav asking, my child is 10 years old and has urticaria and gets hives on exposure to pollen and more. He is an
Okay.
Yes. He is an only child and wants a pet. Is it safe to give a pet to him? Which one will you recommend? We have aquarium, but since he is lonely, will bird help?
Pets to bilkul bhi nahi, that is what I'll tell you. No pets. Even like they produce dander, nahi, bilkul bhi nahi. First of all, get your child tested. The child has atopic dermatitis. This is first thing I will recommend you. If your child is having hives and urticaria again and again, I would recommend he first go look for the cause. If your bacha has atopic dermatitis, if he has it, get it treated. you know and yeah, like you might later stages, if the atopic dermatitis is better by 14 years, 15 years, once the child is mature, once he is like of like getting maturity, and if the atopic dermatitis is getting better, you might give it a trial. But I would suggest no. Aquarium, I would say, is fine. If you have like maybe a fish or two, is fine. I am not sure about turtles, but like definitely no to cats, birds, and dogs. Like anything furry, anything which flies, no. Aquarium you can have.
Okay, so Sonu, you have your answer, and we hope that your child is healthy, he stays well. Doctor, normally when patients visit you with urticaria, can you give us some of the mistakes that people normally commit when they have conditions like hives or urticaria, like not seeing a doctor or taking over-the-counter medicine, etc.? What are the most common mistakes that people, commit, which may actually make their treatment go lengthy?
See, patients usually come to me if I go towards periphery, if I'm not in Bhopal, if I'm going and other centers of mine, if I go there, patients are usually already presented to me with like a big list of things they should avoid. Like they've already done an allergic test, and I look at them and like, why did you go for it, and how much did you pay for it? Yeah, stop doing that. You're spending 10K, 20K, please stop doing that. I mean, you can have just come to me and I would have suggested you what is best for you. Second of all, people come to me with, already experimented levocetirizine. Madam, ये तो हम ले चुके हैं, अब आप दूसरा नया बताओ. Madam, I have to ask them, did you take it? How many days you took it? मतलब एक बार खा लेते हैं, गोली हो जाता है आराम. I mean, it doesn't go like this. Suffering from like 6 months, suffering from 8 months, you take levocetirizine once in a while. It doesn't work like that. I mean, come to me, go to any dermatologist, like just get it treated well. Like just and stop, don't take steroids by yourself. I mean, don't listen to people, and like don't get allergic tests, done during your acute phase. This is one thing which I most commonly see, and levocetirizine. That too on and off. कि एक बार गोली खा ली मैडम हो गया ठीक. वापस एक हफ्ते के बाद हुआ, एक और गोली खा ली हो गया ठीक. I mean, don't do that and stop steroids. Like don't take steroids without any doctor's prescription.
राइट. सी डॉक्टर्स नो कि आपको किस डोज में देना है, कब बंद करना है, कैसे देना है. तो प्लीज अपनी लाइफ से, अपनी हेल्थ से इस तरह से खेले ना. अगर आपको प्रॉब्लम है तो प्लीज डॉक्टर को दिखाएं. द आयरनी इज पीपल आर रेडी टू पे 5K, 10K, 12K, 30K for an allergy test, but then they are reluctant to go and visit a dermatologist. That's really strange. So it's always good to see a doctor rather than spending so much of things on various tests which you don't even know that it's going to help you or not. So please rest everything else on your doctor. Trust your doctor and complete the treatment procedure. That's equally important. Now, doctor, what are the things that you would like to share with our viewers as we are coming towards the conclusion of this session? तो कोई भी ऐसी बात जो आप हमारे व्यूअर्स से शेयर करना चाहे, कुछ हमने मिस कर दिया हो, या कोई एक टेक अवे मैसेज आपका?
First of all, hives, the wheals, the urticaria is not at all contagious. I mean, you need not worry about it. Second of all, if you have it, you maintain a diary, you see a dermatologist. Take levocetirizine if you wish, but again, see a dermatologist and don't abuse steroids by yourself. That's all. And if it's more than 6 months, you try finding out the cause. Like it is something might be internally going in your body which you're not aware of, and that's giving you urticaria. I mean, I would just tell you, like, don't experiment by yourself and see a doctor, like a qualified doctor, and they would be able to help you best.
Yes. So please go and see a qualified doctor, a dermatologist in this case, so that you get immediate relief. And in case you have chronic urticaria, that at least they'll, set the line of treatment for you for your betterment. Don't play, don't be tricky with your health. Stay healthy, that's important. Thank you so very much, doctor. It was lovely talking to you.
Same.
And thank you for your valuable time. It was a very informative session for our viewers, I'm sure. At least now they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they even get to see any symptoms, they now know that instead of self-medication, it's always better to approach a nearby dermatologist and trust the dermatologist and stick to whatever treatment the dermatologist have suggested. Thank you so very much. It was great hearing you.
Thank you, Sanjukta. Thank you for giving me the opportunity. Thank you so much.
And we really look forward for many more such sessions in coming times with you for our viewers. Thank you. And viewers, thank you for your active participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin allergy. We're also available on YouTube, Twitter, and Instagram. Thank you. Goodbye. Have a great day ahead.